Hi everyone, this is Veronica. Today our topic of discussion is about social distancing. I made this video in Hindi long back, but this topic is still relevant, so I thought to cover it in English too. For my video updates and queries, you can connect with me on Instagram and Facebook because I feel together we can make a difference. Now see in what context we are studying this. Because as this video I made on 23rd 3/2020, at that time only 75 cities had lockdown till 31st March. But as you know, right now, what is the scenario? Whole country is under lockdown for 21 days, which will open around 14th or 15th April, right? So during this lockdown, this is still true that only essential services like groceries, milk, petrol pumps, medicines and ATMs, they will be allowed for certain hours. Like in my district, it is like 2 hours in the morning and 2 hours in the evening. So every district administrations have different rules for different places, but there is complete lockdown or curfew like situation is there. And definitely number of states, that time I included this, but now it is for whole India, that in India right now the measures are enforced which aimed at reducing the public gatherings, that is social distancing. So what we are all following this, why this lockdown is there? Because we want to maintain social distancing. Now what is this social distancing? We'll talk about it, but before that let me tell you, if you have not subscribed to our channel, you can subscribe to our channel so that you do not miss any important video update. Now see, to stem the speed of the coronavirus spread so that healthcare systems can handle the influx, experts are advising people to avoid mass gathering. That is why lockdown is there, social distancing, we are social distancing. But this kind of social distancing is almost very unsuccessful in India if when we are locked down in our houses, we are meeting our relatives. So we have to avoid that also. So what does the social distancing means? See, offices, schools, concerts, conferences, sports events, weddings, and like everything has been shut down or cancelled around the world and in Indian states, in India also right now. There was an advisory by US Centers for Disease Control that recommends social distancing measures such as reducing the frequency of large gatherings and limiting the number of attendees, limiting inter-school interaction, and considering distance or e-learning in some settings is important right now. So you can see US has been advising, but they were not following this. So as a result, today what is the scenario? US has surpassed China also. The number of cases have increased in US right now. So that is why our country, our government has ordered this lockdown. So what are the objectives of such restrictions? See, if we compare this particular coronavirus to deadlier diseases, for example, you compare it with the bird flu, you compare it with the H5N1, coronavirus is not as fatal, which ironically also makes it more difficult to contain, because with milder symptoms, the infected are more likely to be active and still spreading the virus. That is what is happening right now. For example, more than half the cases abroad, a cruise ship that has docked in California did not exhibit any symptoms. So in briefing on 11th March, WHO officials, what they said, that action must be taken to prevent transmission at community level to reduce the epidemic to manageable clusters. But that is not happening because community level spread is known as stage 3. I explained that in my earlier video. So we have to delay this stage 3, that community spread should not take place all of a sudden, it should be delayed. So the main question for government is to reduce the impact of the virus by flattening the trajectory of cases from a sharp bell curve to an elongated speed bump like curve. So this is called flattening the curve. So how we can flatten the curve? By definitely social distancing, limiting community transmission is the best way we can flatten this curve. So how you can flatten? See, what happens? So if this is a curve, linear curves are this, that means cases are increasing with specific intervals of time. But this coronavirus, how it is growing? It is growing like this because in less time we are getting more cases. So flattening the curve, we want these cases to come down like this, right? So somehow China has achieved, they are flattening the curve, but right now you have seen the condition of Italy, Germany, Spain, so they are increasing. Now US also, and rest what they are predicting, Italy has been the epicenter. Initially China was, then Italy, then US. Now they are predicting maybe in coming times India can be an epicenter too. So that is why we have to take precautions of social distancing. So talking about China, like what was the curve like in China? So the numbers show that the virus spread with Hubei, in Hubei if you say, exponentially, but it plateaued in some other provinces. Some say it's because many of these countries learned from 2003 SARS epidemic also. So just as Chinese provinces outside Hubei effectively they stemmed the spread in February, three other countries, for example South Korea, Italy, Iran, they are not able to flatten the curve. So that is why social distancing is very, very important here. Okay, now talking about social distancing process. To stem the speed of coronavirus spread so that the healthcare systems can actually handle, our infrastructure could actually handle the patients, we are doing this. So let's have a look at India's preparation, how prepared we are. So saying that India is less prepared if we compare ourselves with US and Italy. They have number one, amazing healthcare system which we don't have in India. So India is very less prepared to tackle health epidemics. That is why India has taken a very good step of lockdown. But why we are not prepared? Given our conditions of urban congestions. So in fact, given the city structure and the way the settlements have grown, epidemics, once they occur, they will spread at a galloping rate, and that you can see right now because number of cases in India are also being increased daily. Even if you look at the slum clusters all around the cities, the unhygienic growth, the poor waste disposal system will only aggravate this situation. So health infrastructure is the basic support for the delivery of public health activities, but current facilities in our country, they paint a dismal picture of the delivery system. I'll tell you some of the figures, and these are the shocking figures, but they are true because you can just see the data. Around 23,000 government hospitals, 7,10,761 beds in the country. This is according to National Health. I'm not giving you this data. This data has been taken from National Health Profile. So like this, you can just take a screenshot of this slide and you will realize why I'm saying that India is less prepared. Then just see, they comprise only 19,810 hospitals in rural areas, and how many beds, then hospitals. So everything is less if we compare to the given population in our country. So what is there? Like, while there's one good thing in this, that our laboratory network has improved after the H1N1 scare. Much needs to be done to improve the community facing primary health services and risk communication to the public, but in general the hospital services can actually quickly gear up to treat severe cases in urban areas, but rural healthcare needs to step up. For example, Kerala's success in responding swiftly and smartly in Nipah, when this Nipah virus outbreak it took place, it should be a role model to other states also. For example, the aerial spread of the newly detected coronavirus, it poses a threat of rapid dissemination, that it is airborne now, they are saying, right? So I have made a separate video which will be launched soon, that whether coronavirus is airborne, how much we need to be get worried about air spread of coronavirus, right? So government is taking several measures like evacuation, visa cancellation for China, social distancing for tackling this issue. That is why social distancing right now is very important. So stay at your homes, stay healthy, don't meet people, don't meet your relatives, because what happens in given settings in our India, we have joint families or the relatives living just near to one another's house. Then we keep meeting our relatives because now we are home, we have a vacation like situation. But don't do that. Just if you have a nuclear family or you have a joint family, stay indoors. Don't let your relatives from outside to come to your homes, and don't go to their homes also if you want to make this lockdown successful. Right now, because Germany, if you see their new social distancing rules, I have just seen few, like public gatherings, they have stopped public gatherings totally. Not more than 2 people can be seen together. They are banned. Right now in India, in certain places, initially we ordered this section 144, not more than 4 people to be together, but right now in total curfew like situation, we have stopped that also, and that is a very good step. Yes, because in Germany the cases are increasing, so they have their new social distancing rules. And even in India, you have seen the new social distancing rules now. It is totally curfew in all the places. A lot of exams have been postponed, and maybe in future more exams could be postponed, but there is no certainty. Let's see how the situation with this pandemic goes in our country. Then we have encouraged private sector organization to work from home. So right now all the MNCs, their workers are working from home. And in government setups, in banks, they are working on alternate days. There are definitely some services where people have to go out, like police, doctors, bankers, and several pharmaceuticals also, and grocery shops are being opened also to help the people, so that there is no shortage of the food items or resources, right? So that is how government is advising social distancing in our country, and we have to take it seriously. So this is all about today's lecture about social distancing. If you have any queries, you can contact me on social media, or you can just find the PDF at t.me in my telegram, on my telegram channel t.me/Veronica_Om, or you can just search Veronica StudyIQ. Thank you. So this is the channel StudyIQ. If you're preparing for UPSC or any government exam, our pen drive and tablet courses are available. If you're preparing for UPSC CSE 2020, our pen drive course is available, where you can find 100% coverage of UPSC vast syllabus. Daily current affair updates will be available. Self-paced learning process is provided. This course has been prepared by top faculties of StudyIQ, and now you can purchase this course at ₹625 per month only. For additional information, you can visit our site, and there are the phone numbers also given. You can call them and gain the additional information. You can connect with me for my video updates on Instagram and Facebook, because I feel together we can make a huge difference. For queries, you can even email me. Thank you so much.